Good afternoon. Welcome to our community conversation series hosted by the North Carolina Justice Center. My name is Keisha Millette, and I am a staff attorney with our Fair Chance Criminal Justice Project. Before we get started, I will turn it over to Timothy Young Jackson, who will explain our tech and our polls that we will be using for today.
Hey, everybody. Actually, I think our attendees are still getting connected right now. So, Keisha, you might have to reread that for us as people are still getting their stuff online. You can do that one more time because I think our people are still filing in right now.
Oh, okay, sure.
Sure.
So, good afternoon again. Thank you all for joining us for our community conversation series hosted by the North Carolina Justice Center. My name is Keisha Millette, and I am a staff attorney with our Fair Chance Criminal Justice Project. Before we get started with our conversation for today, I will hand it over to Timothy Young Jackson to explain our tech and our polling that we will be including in our conversation.
Thanks, Keisha. Good afternoon, everybody. Welcome to our community conversation series. I just wanted to pop in here quickly, just let you all know we have a Q&A form that will always be kind of open. So if you have any questions or comments you would like to ask our panelists, feel free to pop in there. You also can utilize the chat if there are any questions you have. But I'm just going to start it off with a very basic poll. We'll have these kind of going throughout the entire meeting. But the question we first want to ask is how familiar you are with policies related to incarcerated people impacted by disasters, whether that be natural disasters, more recently being Hurricane Helene, or even as far back in 2020 as the COVID-19 pandemic would be considered very much a disaster that affected North Carolina, especially people within the prison system. So that poll will be kind of ambiently running throughout this time, but I will throw it back to Keisha. Thank you all.
Thank you, Tim. This community conversation is part of a series of events for the fifth and annual Vigil for Freedom and Racial Justice. The purpose of the vigil is to highlight and address mass incarceration and state prison safety while providing a public, high-profile platform to uplift the needs and voices and calls for help of mostly Black and Brown North Carolinians who are currently in prison. Our coalition intends to remain standing in collective vigil each day from sunrise to sunset until January 1st, 2025. If you are in or around Raleigh, we encourage you to come out to outside of the governor's mansion between 11 and 4 p.m. each day. Bring a chair. To learn more about the vigil and sign on to support, you can visit our website, which Tim will share in the chat, but it's decarceratenownc.org. So now I will welcome our panelists. So we are really excited to have a group of folks who can share both about the landscape in Western North Carolina post-Helene and thinking very specifically about the impact on folks who have been incarcerated out west. Our discussion topic is thinking about second chances in the wake of disaster, and each of our panelists brings a wealth of experience and perspective, and we're honored to have them here. I will allow each panelist to briefly introduce themselves, but I will turn it over to our discussion moderator, Elizabeth Simpson.
Let me unmute myself. Good afternoon, everyone. I am Elizabeth Simpson. I use she, her pronouns. I'm an attorney and the strategic director of Emancipate NC. Going to be moderating the discussion today. We're hopeful that we'll also be joined by April Barber Scales, who may be joining a little bit later, but I will first turn it over to Philip Cooper to introduce himself and the work that he does out in the western part of North Carolina. Welcome.
Right on. Hey, everybody. I'm glad to be here and blessed to be a voice for the people once again. Do you want me to talk about my work or what's been going on in the disaster all in one swoop?
Just start out by introducing yourself. We'll have Luke introduce himself, and then we'll do some questions.
Okay, right on, right on. So, Philip Cooper, I am the Chief Change Agent at Operation Gateway, and our mission is decreasing recidivism by addressing the social determinants of health of returning citizens. Glad to be here.
Thank you so much. And Luke Wooler, will you introduce yourself?
Hey, I'm Luke Woolard. I'm a staff attorney with the criminal legal team at Disability Rights North Carolina. We are the federally mandated protection and advocacy agency for people with disabilities. which means the ADA and some related statutes give us sort of the duty and the right to monitor and advocate for the rights and dignity of folks with disabilities. And I work specifically with incarcerated populations, trying to help folks get everything from individual accommodations to sort of broad policy change in the prison and jail system in North Carolina. I'm really glad to be here.
Thanks. So Philip, if you'll get us started, we understand that you are located in Western North Carolina and that you've been assisting people who are returning citizens coming out of prison, and that you're familiar with the conditions that were in the prisons during Hurricane Helene and post Hurricane Helene. So if you could update us about what's going on out there, I think we'd all be grateful.
Right on. And so, it was already hard. It was already challenging, trying to provide reentry services with the best practice, which is, pre-release engagement. So that wasn't happening the way that we needed to happen prior to the hurricane, and the hurricane just exacerbated it. It became even worse. You did like when people was getting out, we wasn't getting communication that we needed pre-release to even be able to receive them. We was like getting notification once they would get to a halfway house, right? And so that was challenging for us. We had several of our team members who was impacted. We had one of our leaders. He lost a whole car, right? His whole car was washed away. So we had team members who was impacted by it, who lost, belongings. They lost the car. One lost a car. So it was rough on the team. So let's first put that out there, you dig, and then looking at the returning citizens, and keeping in mind that all of our reentry navigators are formerly incarcerated, right? And so then the people who was getting out, we was getting them last minute. DMV was closed, so it was hard to get their IDs. You can't get a job without your ID, you dig? So that was a challenge. But getting the ID was already hard, right? Because the DMV has its challenges. But when our DMV closed, then it was even crazier because we was having to take people several counties over to get an ID. Like we had to do that a couple of times, taking people from Buncombe County to Catawba County down there in Hickory, North Carolina. Also, it was hard for us because like the fair chance employers were laying people off, right? So the typical employers that we would usually rock with for our people were laying people off and not hiring at all. So people wasn't getting to work soon enough. So they was getting put into these halfway houses with no communication with us, and us coming to save the day, right? But just paying for 1 month of rent wasn't good enough no more because people wasn't getting to work as quickly as they typically would prior to those fair chance employers and small businesses being impacted by Hurricane Helene themselves. Access to medication for opioid use disorder. Some call it MAT, I call it MOUD, baby. And so people's ability to access that, it was crazy. We had some anonymous doctors who stepped up and partnered with a foundation to make sure that people could get access to their medication for opioid use disorder. And so we had to pivot to make sure people got what they needed. And then shout out to our MAHIC, which is in Asheville. We're partnering strongly with them. We was able to make sure people had a sustainable plan to continue to get their medication. But yeah, man, it's been rough, and it's still rough because, like I say, the one social determinant of health called economic stability has been impacted. So people's access to gainful employment has been impacted, and that impacts the whole person, right? And so that's us continuing to raise funds for more rental assistance, because these halfway houses, they got bills to pay too. So the halfway house owner has to pay their bills. And so we're still raising money, and we've had money come in from different foundations. I want to give a couple special shout outs to the Southern Power Fund, Impact Health, United Way, um, the Just Trust. We had funding come in from the Western North Carolina Community Foundation, and so we're grateful. But I'm gonna tell y'all, it still is not enough because we're still dealing with the disaster relief effort.
Thanks for sharing about that. Turning to Luke from more of a policy perspective, we know that the prisons want to treat natural disasters as isolated events, as one-offs, as things that, that's an exception to the rule. Wondering if you can kind of share how you view disaster in context in terms of an incarcerated population. And I do see Timothy has a hand up. Do you need to get in?
Yeah, just wanted to pop in and go ahead and share the results from our first poll we had earlier. So let you all know that our first question was how familiar you might our participants might be with policies related to incarcerated people impacted by disasters. So about 80% of our participants today in the audience are not familiar at all with any of these policies related to disaster and these policies related to people incarcerated. And so just wanted to share that with y'all right now. And I want to launch our second poll, which will be will be shared shortly, related to if people are have anyone they know or care about that are directly impacted by disaster right now, specifically Helene or maybe some of those lines. So I will throw it back to you, Elizabeth. Thank you for letting me pop in.
Yeah, thank you. That's a great segue to what Luke's going to be speaking about.
Yeah, so our experience and DRNC, along with I think most of the organizations on this call, were involved in the COVID lawsuit, where the prison had another disaster of COVID, come through, and we essentially had to sue to get them to reduce prison populations at all for safety reasons. And we're seeing a lot of the same playbook and a lot of the same problems with this. Like Elizabeth said, they like to take every disaster as something that couldn't have been predicted, that they have to scramble to fix, and that they are doing everything they can to fix. And I think we're kind of seeing that that's not really the case. Both COVID and this, you've got situations where a natural disaster made it such that you cannot fit, as you have a space problem. You cannot properly care for the number of people in your custody. That's both with physical space available in facilities, with the closing of the 4 prisons in the wake of Helene, and with the spacing requirements of COVID. You also had exacerbating factors of a lot of the staff are also affected by these disasters. So whereas DAC has 30-40% staffing shortages already, that's going to be exacerbated by folks who have to deal with their own stuff. They might have had their homes wash away. They might have had their family affected by COVID. It exacerbates pretty much everything. And I think we've also seen sort of the same playbook, which is really, not fast or not fast enough action initially. I'm not saying they could have seen COVID coming or the extent that Helene would affect things, but really we see them more focused on moving people around, trying to solve the problem without fixing what is really the root cause of the problems when these disasters hit, which is, again, you don't have the space or the resources to properly care for the people in your custody. We see them, spending what I think is a lot of money on sort of PR to make it seem like they're really, fixing this problem. You can read some of the filings from the COVID lawsuit about how we sort of think that that's not the case. And unfortunately with COVID, we saw, advocacy agencies asking wasn't enough. It required a lawsuit to really get them to do what they needed to, which again is reducing prison populations. I mean, that's at the heart of this. Every time there's a disaster, it hits a prison system that already is redlining. We already have staffing shortages. We have medical staffing shortages. We have facilities that have limited bed capacity because of just the state of the building itself. And when a disaster hits and suddenly those resources get stressed, you need to find a way to close prisons and fit people, or give them more space, as with COVID. There are, serious tools that they have at their disposal in terms of releasing people, whether that's for medical release, putting people on extended limits of confinement. For the older folks, it basically means you monitor them, but you let them, serve out their time in the community. You stop bringing folks back during a disaster from parole violations for, the less serious parole violations. So, hey, you've got an overcrowded system. Why are you sending this person who happened to be, 15 minutes late for a meeting with their PO back into that system? They have tools that they can use to reduce prison populations, and we see them to being just incredibly reluctant to use those. The mentality seems to be, well, we're gonna maybe try and do what we can, move some folks around, but everyone's just gonna have to weather this out. Which, really unfortunately usually means, um, reducing the rights and the dignity of the folks who are incarcerated. You see it in non-disasters too, whenever there's a resource shortage. Instead of saying, let's look at this in terms of how many folks can we safely keep in our custody and trying to hit that number, they say, well, that number is not going to change, and we're going to have to take away programming or time out of cell. There's going to be reduced medical care facilities because we can't hire folks. They really seem to not consider or write off the idea that they have tools at their disposal to either release people in an emergency who they could then bring back if it's ELC, or to otherwise lower the population. Um, None of that is asking them to let folks out who haven't served their mandatory minimums. These are all folks who have served their statutory minimum who we're talking about, or who are on post-release and could be kept on post-release instead of brought back into the facilities. So uh, really, that's, it's the mentality. We see them also not learning, right? If everything is an isolated incident and everything is a one-off and everything is something that happens once in a lifetime, there's not a lot of incentive to learn from it. There's not a lot of incentive to build up the system after the disaster so that it can maybe better weather the next one, right? We're just going to try and get back to normal. We're going to try and reopen these facilities as quick as we can. And we're going to, not that they're not trying to address staffing issues and things like that. We hear them report to the legislature all the time that they are, but they're not trying new methods, that they're not trying to lower the population in order to fix those staffing ratios. And we just like to see them use all the tools at their disposal, both to react to these disasters and also to prepare for them. Now I got my fingers crossed as everyone else did. We don't have another situation like COVID, but in my opinion, the natural disasters, that's something you got to prepare for in the day and age that we live in. And I'm hopeful that they will, but we have not seen it yet where they're really trying to build back and use every method that they can to create a system where, again, they have the resources and the space and the people to safely incarcerate folks.
Okay, so I think we're going to turn back to Timothy for the poll results.
Thanks, Elizabeth. Yeah, I just want to show you all because we asked if are people in the audience that know someone or is directly impacted by a disaster while incarcerated or experiencing reentry. We have about an even split. We got about 33% said yes, 33% no, and 33% aren't sure if they know someone who's currently being impacted by that. So I'm going to show those results real quick. But I'm also going to launch our next poll, our next question for you all, which asks, what do you believe is the most significant barrier to second chances for individuals impacted by disasters? And we have a couple options out there. And if you do select other, if you think there's a different barrier that is not listed there, feel free to enter in the chat. And we would love to hear about what you think those barriers might be. I'll throw it back to you, Elizabeth. Thank you.
Thanks. It looks like we have April Barber-Scales joining us by telephone. So I'll invite her to unmute now. Introduce yourself, April, who you are, where you come from, and then also maybe share some about your information about what's going on in the women's prisons in North Carolina right now post Helene.
Yeah, April might have a some sort of issue with being able to unmute her phone once she's being called in, but if she's able to maybe figure that out at some point, it might come back to her. But I think she might be having.
Okay, well, I'm glad to jump in and talk a little bit about the ladies' prisons until April gets that straightened out. I'll share that Emancipate NC. We were involved in that COVID lawsuit that Luke was talking about back in 2020 into 2021. And the result of that was what we felt was a big victory because it was decarceration. It was the release of nearly 4,500 people out of the prison to serve the rest of their term in the safety of community at their home with their family and their friends, getting a head start on reentering and returning to society. And what we discovered in that process is that that was completely safe, that there was not any kind of, crime wave or, danger to the community. These were all people who were completely, ready to be back home and were successful there. And I think what that teaches us is that we are incarcerating way too many people in North Carolina. This is a project that is extremely expensive. It's extremely difficult to manage, to house, upwards of 30,000 people. At some points of our state history, upwards of 40,000 people against their will. You have to feed them, clothe them, give them medical care, bedding, supervision. This is a very expensive project and it's not necessary at all. There really are not that number of people who need to be in prison in North Carolina. And when we have these disasters, I feel like the system is stretched to the bone. Like there's no give at all. And so when you have a disaster, that's where you see it just completely fall apart. When the hurricanes hit Western North Carolina, you had people who were living for several days without running water, without access to toilets, without access to fresh food, fresh water. electricity, and stories that we heard from some of the women in the prison in Swannanoa, now called Western Correctional, was that they took a journey to Anson Correctional that took several days. They were shackled on the bus. They were just wandering through the countryside, waiting for bed space to be available at Anson. And the way they made it available was to, put some pallets on the floor of the gym. This is a facility that's not meant to house people overnight. They don't have bathroom facilities. They don't have telephones. And, these are going to be individuals who have family at home. Most women who are incarcerated are mothers, and so they have children at home. And when they arrived after days of being incommunicado, there's not enough telephones, there's not tablets, they can't reach their loved ones, they can't reach their legal counsel. People are just petrified of what happened to their loved ones, and they're going to end up sleeping on the floor for several days without access to good food, water, bathing facilities. It's a really inhumane condition. And what we know is that it's not even necessary to keep the community safe to have these people locked up. We're spending a lot of money and we're hurting people just for a show, is really what it comes down to. This past summer, here comes April. I'll let her take over because I know she has a lot of stories from people in women's prisons.
Oh, yes. Sorry about all this. Yes, you were absolutely right, Elizabeth, with everything that's going on. And they were forced to be in pods that were packed with like 84 people that typically only house about 60. They had access when they were sleeping in the gyms to only 2 bathrooms. Yes, no tablets. It was a mess, and they're still not entirely together, I think. Even though they're back, I haven't heard any like major reports of anything extreme going on, but the only report was we're back, yuck. So whatever that entails, I'm sure they'll inform me as to what the yuck meant, but probably that things are still not together for them. And I'm sure it's going to be a mess going back to work, their programs, their sponsors, and all that.
Will you introduce yourself, April, and just, who you are, what your background is, and...
Oh, my name is April Barbara Scales. I am an author, advocate, peer support specialist, but for 31 and a half years, I was incarcerated. And March 24th, 2022, Governor Cooper commuted my sentence through the JSRB process.
Thank you so much, April. Thanks for joining us. Is it all right if I go on to another series of questions, Keisha? Do we have time for that? Great. So I'll go back to Coop again, and this question will be the same for everyone. The question is, what would you like to see from, we have a new governor, Josh Stein. He was our attorney general. He definitely has familiarity with the prisons and all this litigation. His office was involved in defending the prisons. So what would you like to see from his administration as he takes office?
Well, one thing I want to say that I didn't say previously about the returning citizens, the impact of the hurricane for returning citizens, specifically those living in halfway houses, is that it was cumbersome for them to get the serious needs assistance from FEMA because at a halfway house, everybody has the same address. So by the time that we figured out a way to work through that, shout out to our partners at Pisca Legal Services. But by the time that we figured out a way to work through that, these people were super duper struggling. Some of them have been able to have successful appeals in which we helped them with their appeals as well. But just saying that was another hard part for people that lived in halfway houses trying to get FEMA assistance. Regarding
that's a really great point, just to make sure people understand that FEMA had a rule that only one person per address could apply for this money, as though there aren't households where there's multiple people living together. And so people in halfway houses were really suffering over that.
Yep. And regarding the new administration, I'm optimistic. I did get an award from Attorney General Stein, a Dogwood Award for the reentry work. And he sent a letter. He wasn't able to attend our gala, but he sent a letter, so he knows who we are. So that makes my heart smile itself because I know a lot of this change comes by way of relationships, right? But what I would like to see is us take the recommendations from the the existing committees and everything like the SRC, the Statewide Reentry Council Collaborative, and looking at the recommendations from the new Joint Reentry Council that they have, and then him being intentional, his administration being intentional about tangible tactics after the recommendations. Because if the recommendations don't have the energy and don't have the strategy under them, then they'll just look very good on a nice piece of paper. Kind of like what my brother Luke said. He said it so well. We can invest in PR and we can kind of like trick everybody based off the PR. But I'm the kind of guy like it's some great recommendations on there, but then it's like, okay, what are the next steps for us to really impact these returning citizens? Because we've had local reentry councils, we've had all these different things, but we haven't seen an improvement in the outcomes for the returning citizens. And so one of the main pieces that I would say is like making sure that community-based organizations are at the table. And even when we do have lived experience, we can't limit ourselves to lived experience that's working inside the system. Because when you're working inside the system, you're limited on how far you can go. And I'm not going to ask one of my comrades that's formerly incarcerated that have cooked food in a trash bag, that have had to go to a monitored visit with their kids to jeopardize their livelihood, right? So we can't put people that have lived experience working inside the system in these tokenized positions and expect them to be an authentic voice for all justice involved people.
Thank you so much. Luke, do you want to jump in on that question?
Yeah, I agree with the most part, but part of my job currently is going inside the jails and prisons if they would let me. So, and I do have the justice involved experience. It does need to be a collaborative effort, but those of us that have lived through that know what we need on the inside to begin our reentry journey, as well as what we need, or the basics of what we need upon our release. So to put us in those positions and to have us at the head of the table would be probably the best option, because who knows better what we need than us? And even though I'm not the inside us, a part of me will always be an inside us. I'm out here fighting still for the conditions that I lived through for 31 and a half years. So I kind of disagree with that, even though I see what you're saying, but I think it just needs to be more of a collaborative effort.
Yeah, if I may clarify, so I mean, people with lived experience definitely need to be inside of the prisons. So when I say working inside the system, I mean staff members who are government employees. Like if we have a staff member who is in a government employee position and expect them to disrupt the system from the inside, that would put them into a bad position that could jeopardize the livelihood of their family. But no, I'm not saying that we don't need to be inside the
Okay.
prisons. We need to be inside the prisons. We need to connect with people pre-release. We need to be the ones who are helping them with their Medicaid applications. We need to be the one to make sure that they have quality continuity of healthcare. Shout out to our people at the North Carolina formerly incarcerated transition program. So Miss April, no, I definitely feel like we need to be inside the prisons like yesterday.
Okay.
Do you want to add anything, April, to what you'd like to see from Governor Stein or Governor-elect Stein?
Hopefully he will follow the same Democratic trend as Governor Cooper. I mean, we don't know. A lot of times when people come in these positions, we have to guide them in the direction that we need them to be in. So I think that all of them will do well with guidance.
Thanks. Luke, do you want to take that question?
Yeah, I guess I don't know. I'm gonna speak a little bit theoretically here, because if you want a practical laundry list, mine's like 10 pages long, and I don't have the time to read it all out here. But I think if you're coming in, I mean, Josh Stein, has been in state government a while, probably knows the issues with the prisons. But come in, you've got, appointing a new DAC secretary, you have an opportunity to look at the system and the problems that have been plaguing it for years, and look at what previous administrations have tried, and see what has mostly not worked to solve this problem. Look at what they haven't tried, especially, and I agree, things like getting peer support folks into the actual facilities, having, asking the folks who have been criminal justice involved, like what they need, what would have helped them, even down to listening to your own studies. When your studies say putting people in solitary confinement significantly increases the risk of death upon reentry to their communities within like a very short time, take that, y'all invested in that study, and NCDASA did. They did a big study with Duke and UNC, got those results, and then did very little to try and stop the use of solitary confinement in those facilities, right? And they've done that a couple times. So a lot of the things that you could do to improve this are not leaps. You wouldn't be the first state to try and get rid of solitary. You wouldn't be the first state to let peer support people in. Look at what hasn't worked to fix the problems that you've had for years, and look at and listen to advocates, justice involved people, what the science is telling you, and apply that. And really just, and I mentioned it before, but in broad strokes, resources are always going to be an issue. And we need to get away from the idea that, well, the institution is just going to go one way and everybody's just kind of going to have to deal with it. And we can't look at new and other ways, to fix these issues. And I think another, and I'm gonna try and phrase this judiciously, because I know a lot of the folks on here do great work with reentry. We certainly need all the resources that DAC, to the degree they have put towards reentry, and all the focus on reentry. We need more, if nothing else. But we need that same focus and that same willingness, to what degree they are, to work with folks inside before folks get released. From the time they go in the doors to the time they get out, you need more programming, you need more mental health care, you need to get rid of things like solitary that are damaging people, because as much as I would never ask that, anything be taken away from any resources that state wants to give to reentry, and you've got a lot of folks out there who aren't even with the state who are doing great work, the damage that happens to folks inside comes outside. Of the 30,000 people that we incarcerate a year, 20,000 of them come back to their communities. Like, that damage isn't staying inside. It makes reentry all the much harder. It makes reconnecting with your family and your community all that much harder. And if you really want to get out there and say, as they have again, the PR thing, we're focused on reentry, we don't want recidivism, we want these folks to come back, you can't just have them suffer all this harm, let them out the door, and then say, okay, well, now go to these reentry programs. You need to, at the bare minimum, have them come out of those doors the same as they went in, if not better, if not having had opportunities to better themselves and get programming, maybe get mental health care they weren't getting in our communities. Lack of community health care is a whole separate problem, but focusing as much on what happens inside as they really seem to be trying to do on what happens, outside. And just as if they, and this is within the disability community too, listening to folks. What do they, don't try and anticipate what they need when you've got peer support specialists, people working in this field, people who you could ask when you're coming to things that, programming you're trying to give. I mean, I think a decent example is that, getting driver's license and trying to have access to those and getting those in people's hands before they get out has been a priority that they've said they've had for a long time. And they recently instituted a system that makes anybody who's been in for 8 years ineligible to use that program. And so then they have to navigate that when they get out, which doesn't make sense if you think about, when does a driver's license expire, right? They're usually like 10 years. So it's going to be the people who have been in for your 10, your 15, your 20 years who are going to need that the most. And they kind of designed a system that does not take that into account. That's like one example of, you could have asked folks, you could have asked community leaders, you could have asked folks who've experienced this when you're trying to create these programs, what they want. You can listen to them. And especially, I think, in the wake of disaster, just don't turn away from this population. There is a need, I think, when we're going through recovery periods with either COVID or disasters. Everybody says, okay, we're going to try and rebuild, we're going to try and move on. And the people who often get left behind in that are the most vulnerable people in our societies, the people who have just re-entered, the people who are still in, people with disabilities generally. And I think there is a tendency, and there has been throughout history, to say that's a difficult population to look at. It's uncomfortable for us as a society to look at them and say, okay, well, we need to help these folks. These are our people too, just because they happen to be incarcerated or have a disability. We need to care for them and make them a part of society. I think there's a tendency to put them in institutions and not look at them anymore, and not be too concerned with what happens in those institutions. And I would really caution them away from that. And again, I think with new administration, new DAC secretary, you've got a lot of opportunity there to make some shifts in just institutional momentum of how you're going to run things, that could be incredibly beneficial to the folks who are currently in DAC custody and the folks who, have come out and are trying to deal with reentry.
Thanks. Did you want to jump in? I saw your hand go up.
Nah, I was trying to hit my reaction button because I went in the
Ah.
amen corner when Luke was popping off, but I don't have it as a panelist. I'm missing that button. It only raised
Okay.
my hand.
Great. Well, I'll just take a moment and answer the question myself. Also, I guess probably theoretical, but one thing that I would like to see, I know he's a Democratic governor in a state that has almost a supermajority in the legislature, who has various Democrats in the legislature that, oh, April, do you have something to say? I just thought she went off mute.
Okay. Yes. I just wanted to add that the next administration does need to take into consideration to not limit people that have to the education and the mental health and all these other reentry services to those who have a long sentence. The problem that has always existed, if you don't have less than 7 years, less than 2 years, you're denied access to these programs. So you haven't developed your social skills. You don't know, you're not able to convey to a case manager what you need because they're under the impression that you're never going to get out. I mean, I was one of those people that was never to get out, but I was one of those people yet that continued to fight.
Hello. I haven't looked at my email yet. I'm sorry, but in between emails,
but I can continue to fight, and I was able to become free. So they don't need to limit their programs to those who have a long sentence. And I really don't know how we can express that any more than we already have.
I think that's absolutely right, and that really fits with what I was working up to say about not giving up hope on people. And I think that in the context of a governor who, he can't change state law by himself, he can't change our sentencing scheme, he can't change the way, sentences keep getting imposed and people keep getting sent to the prisons. And I know often I've heard people in the prisons say, like, we don't have a choice. They send them to us, the judges send them to us, and we have to take care of them. And that's the end of the story. Like, we don't have any, it's not our fault, essentially. Like, talk to somebody else. But I think that allowing for hope means that anytime there is some kind of safety valve, whether it's, the commutation and clemency powers of the governor, whether it's the ELC program, which is the extended limits of confinement program that allows the Secretary of Correction to permit individuals that he trusts to serve their sentence outside of the gates. Those are discretionary programs that the executive branch does have, and can give hope to people, can give people something to work towards, right? Like, if you're sentenced to life without a possibility of parole, like April was, you could keep out hope that maybe something will change and you will be able to see life outside of prison someday. And that would, if there were programs available to you, if there was education and, work study that you could do, that you would take advantage of those things, and you would be trying to better yourself and trying to keep the hope alive. And I think that additionally, in the Attorney General's office, they can have that same mentality when they are, asked to defend against post-conviction motions, MARs, and habeas petitions, like whatever the thing is, they could actually, look at it with an empathetic eye and think expansively about what the law is and what the law should be, what justice requires in these instances, whether it's death penalty cases or, something that is a more standard sentence. And they could stop opposing it so vehemently. They could stop, writing petitions for cert to our state Supreme Court to, make bad law that's going to hurt more people in the future and make it even harder for people to correct sentences that turn out to have been disproportionate, turn out to be unfair, too long. I think those are things that the governor and the Attorney General can do to have a mentality of hope and mercy and forgiveness, even in the context of a legislature that is not going to change the laws. And I would hope that they would do that. And I think the safety valve programs like ELC are designed for disasters like Helene. They're designed for instances where the prisons say, you know what, we can't hold it together. This is not safe. This is not humane. This is not just. And so we need to let some of these people go, and they should let them go. Keisha, where should we turn from here?
So I can pop in for a second.
Okay.
I want to let you all know the results from our previous poll about asking people what they believe is the most significant barrier to second chances for justice affected people affected by disasters. I'll show those results now. It looks like about half of our participants believe that economic challenges are one of the biggest barriers. Closely behind is the social stigma, and right behind that is the lack of policy reform. All those being what they would consider to be the most significant barrier to second chances. I'll take that time to launch our next poll. Thank you all for participating so far. Our next poll is going to ask, do you think the current state policies adequately address the needs of incarcerated people affected by disasters? So please take the time to answer that. But we also have a question in the chat. I can read out to all of y'all, our panelists. Was asking, they said, I have an incarcerated loved one affected and displaced by Helene. Could you share resources with us to help us fight for our loved ones in a way that, or any way that we can get involved? They said their loved one is a nonviolent offender, and they said they're a model person with no record since they've gotten incarcerated, and they would be better suited for a rehabilitation program rather than a prison. I think a lot of people can agree with that. And they said that this person has elderly parents, 5 kids, and 3 grandchildren. So I'll turn that back over to you, Elizabeth, however we would like to field this question. But thank you, whoever asked us this question. Thank you for participating. Again, we do have a Q&A section in this Zoom. If you have any questions for our panelists, we are more than willing to read those out.
Thank you so much for that question. I think that really captures the kind of stories that we hear all the time, like lots of people in prison. That's exactly what the situation is. Obviously, the number of kids, the number of grandchildren varies, but the upshot is the same. This is a person who is loved, who is and loves others, and they don't belong in prison. And is there anything we can do? I see that Coop has asked for a referral to be emailed to him at info@operationgateway.org. Coop, do you want to speak to what this person might be able to do to help their loved one?
Yeah, sure. So if the loved one has substance use disorder and is in need of being connected to medication, chronic illness support, that's what we would be able to step in and do. And so what you could do to advocate for your loved one right now is be a voice for your loved one. In the absence of a case manager communicating with us, you shall be his or her case manager, right? So there are times when a family member stands in the gap to improve the outcome, right? But most of the time, people aren't blessed to have someone like the person who just had that inquiry. So do they have substance use disorder? Do they have chronic illnesses? But you can go ahead and email to info@operationgateway.org, and someone from our team would be able to follow up with you and discuss what next steps could look like, whether it's them moving into sober living residence, and we do have funds to help people move in, and there is bed availability in halfway houses now that they're back up and running here in Asheville, which is the most recovery friendliest part of the state. So yeah, we'll be on the lookout for your referral.
Thank you so much for that. And I see Luke's hand is up.
Yeah, I was just going to say, if the person, I hope they're getting out soon, but if they're not and they have a disability, and just a reminder, substance use disorder, mental health issues, anything that, affects your ability to sort of live your life is, probably can be kind of disorder, or you think that they might, and they're not getting adequate accommodations, medical care, mental health care, anything like that. I will drop Disability Rights website in the chat here. We have an intake process that I invite you to go through, and we can we're working through the backlog right now, but we're trying to get to everybody, and we can help you try and advocate for your person with resources, or get involved ourselves in certain cases, trying to get that person the accommodations they need, the health care they need, the mental health care they need, things like that.
Thank you. We'd also like to invite anyone else in the audience who has questions, whether they're specific to someone or just general policy questions, curiosities you have, to share those questions. And also want to make sure April has a chance to speak if she wants, and she can't see us. Anything you want to add, April?
No, the only thing else that I would add along with those wonderful resources is that to reach out to the detoxes in that area, because they will also know of the local resources. Like, we don't have a Freedom House per se in that area, but there is one like Norlina. So there'll be other smaller organizations that have mental health and substance use disorder resources. The local reentry councils should know them as well if they're being updated. So I would include that information and invite them to the table also.
Wonderful, thank you. Timothy.
Yeah, I just want to pop back on, let you all know that our next poll has closed. Our question asking our participants, do you think the current state policies adequately address the needs of incarcerated people affected by disasters? To nobody's surprise, not a single person did say yes, but we did get some no's and some unsure. So thank you all for participating and following us along here. But I'll go ahead and just launch our next poll for all of you. This next one is going to ask, once I stop sharing that, next one is going to ask, what is the most effective way to advocate for incarcerated people if affected by disaster? I think this is very fitting, especially because we got a question in the chat about asking how they can advocate and get resources for those people behind bars. But this question might even be asked to our panelists here, but we do have some examples, writing letters to state officials, attending the vigils or rallies. In other words, in the middle of our Vigil for Freedom and Racial Justice right now, social media campaigns, partnering with those impacted families, and other. If you think that there's another way, another really effective way to advocate for these folks, we would love to hear it in our chat. So I'll go off mute and I'll throw it back to you all. Thank you so much.
Thank you. While we're waiting for those results, just a reflection that with climate change, I know that we're expecting to get a lot more natural disasters in the upcoming years, extreme weather conditions, things that are going to impact incarcerated people as well as people on the outside. And people who are incarcerated don't have the power to take care of their own circumstances because they are controlled by the state. Their movement is controlled, their whereabouts is controlled. And so it's a really dangerous and volatile situation. I know that at Emancipate NC, we've recently reached out to some of the environmental justice groups in North Carolina to see if there are partnerships that we can start to forge between environmental justice and climate groups and people working on civil rights, incarceration, and other forms of civil rights, because the intersection of these issues is going to become more and more clear in the coming years. And while the prisons may act like every new disaster is a surprise and they couldn't have seen it coming, I think that we can all see that more of these types of extreme disasters, hurricanes, in Western North Carolina causing flooding like never before, not something people expected, but now I think we have to say to expect the unexpected, that anything can happen at any time and that we have to be ready and be planning ahead for these things and taking care of those that we have decided to put in cages and make sure that they can't take care of themselves. Now they're our responsibility if we're going to do that. Should we turn to some closing activity, Keisha, or how should we finish
We have
this up?
one more question.
Okay.
Yeah. I can read the question if you'd like then, Tim. So this person says, I'm justice involved, work for a DAC transitional facility. I'm having an issue with my son who has an undiagnosed mental issue and substance use disorder. Are there resources for assistance with funding to assist with paying for a long-term dual diagnosis residential facility? So if anyone has ideas or response to that.
What side of what part of the state?
So if you would like to come off mute, just raise your hand, and we can hear more from you.
Go ahead.
Did anyone say what part of the state?
Well, I can say without knowing the part of the state, just generally, that is, the long-term care homes are not my field. I deal pretty exclusively with the criminal justice system, but DRNC is a pretty big firm. We have people who deal with that. So again, I would say, go to that website. It's disabilityrightsnc.org. Go through our intake. There may be some stuff we can do to help you. Certainly, we can almost always give resources about what's going on. If not, individual advocacy. It's going to depend on your individual situation and sort of what's available to you. But we can, at least certainly, I think would be able to give you some self-advocacy resources, if not more. Sorry, I can't say more. Just that's not my field. I don't want to go off on something that I don't know about. But we do have folks who deal with that specifically.
We have some
with
partner. Oh, sorry, go ahead.
Well, I was gonna say with my county, they have funds available for things like that. I know the justice involved. I mean, we have like a bail bonds program, so I would contact the resource department in that county and see what funds that are hidden, because I didn't realize that we actually had a bail bonds program for people that can't afford to get bail money out, and it's ran by volunteers and strictly ran on donations. So I know that we have funds also, especially if the county receives funds from the opioid settlement money, then those counties have money that are specific toward treatment. So I would definitely reach out and see if those counties are a recipient of that money.
I just shared my email in the Q&A. We have some reentry partners in Wilmington too, and they may be also able to more directly support. And I guess there was an ask for you, April, about how to access the information that you just mentioned.
Which about check the county. Just check the criminal resource department in that county to see what funds they have available, and it should be on their website. With Orange County, it is on their website, and it is under the Criminal Justice Resource Department.
Okay, great. Yeah, we'll do. Oh, go ahead, Phil.
Did we ever hear what county yet?
So it's in New Hanover. It's in Wilmington.
New Hanover County. I would also say a good place to start would be with the local management entity, management care organization. And there is a locator here. I can look it up, MCO locator. And that would be a good start because I know they've started to put reentry staff into the LMEs now. I know at Via Health we have them, and so green is Trillium. So it looks like Trillium would be a place that you could contact, and they have I can drop. I don't know if I can access them, the people on the call, but I can drop it in the chat, and if they can get access to that, they'll see where Trillium, and it has their contact information on there. Maybe they have reentry set up at that LME as well. I will say that they're all about connecting with people who have severe mental illness, severe and persistent mental illness. And I don't know if the loved one is a minority or not, but I know a lot of times we go undiagnosed because of the stigma in our community, right? And so we usually have to see someone when we get out of prison if we didn't already have a diagnosis. So I would say that it is very important to connect with the LME as soon as possible to see who could even provide a comprehensive clinical assessment, because if it's not diagnosed, I'm not for sure if you would be able to get the resource that you need.
I do have one last option, and that would be your NAMI chapter in that county. Every county has one and has a location. So look up NAMI, that's the National Alliance for Mental Illness.
Thank you.
Sure,
And
New
Tim,
Hanover
do you have
County.
one more poll
Yeah.
to share responses to?
Yeah, no worries. Thank you all for helping facilitate that question. Hope that this person can get the resources they need. But I'm going to go ahead and close this current poll we have, asking about what is the most effective way to advocate for incarcerated folks. I'll go ahead and share the results too. Looks like we got a pretty even split. Sounds like writing letters to state officials is up there as an effective way. Social media campaigns and partnering with those impacted families seem to be all methods that folks think will be great ways to advocate for those folks. I'm going to go ahead and launch our next polling question. We're reaching near the end of what those is, but this question is going to ask an open-ended one. So if you want a little bit of homework, but the question is, what is one action that you think advocacy groups should focus on next to address disaster recovery for impacted folks and so impacted individuals? So so feel free to type that answer in this poll. What is one action you think advocacy groups should focus on next? But I'll throw it back to our lovely players. Thank you.
Thank you. And I wanted to also pose to all of you as panelists, what is an action that you think would be really important and helpful for folks to take in this moment? I know, Coop, you had kind of were prepared for to respond, but other folks feel free to share as well.
I mean, you might as well do all of them and see what sticks, right? Really, I think everything on that list, I mean, we kind of learned this within the specific issue of solitary confinement. We on our own had been advocating to try and get even just a data, what we call a data bill, like tell us who's in there, tell us how many of those folks have been on us. For years, never got past somebody introducing it, and then it just died. And then we partnered with the national in solitary organization, and really our campaign was focused not on litigation, which was being done by the ACLU. It was just public awareness, right? And sort of, I think, that's run by Dr. Craig Waleed, who would have more in-depth knowledge of it than I would. But really, I think what we saw was organizing first. It's great to write letters, it's great to do all that, but it is even better if you can organize a group or get groups you're already involved in, church groups, neighborhoods, anybody like that. I mean, like I said, 20,000 people coming home more or less from prison facilities every single year. There's more people out there for who this is maybe an issue for them or for a loved one or for a family member. But we just sort of don't talk about it. And I think this is not all politicians, of course. I think there are some politicians, some people in power, up to and including maybe even the governor, who aren't necessarily opposed to doing these sort of reforms. In fact, might even morally want to, but they are first and foremost looking for political cover. They're trying to make sure that they are not going out on a limb by championing a new idea or a new reform or something like that. And organizing support through things like, talking to community groups, going to rallies, to meet people, and then using that support to voice your opinion to these policymakers, to the stakeholders about what you feel needs to happen within that community, I think can be a powerful thing. We do live in an age where a lot of folks are secure enough in their seats and, whatever seats of power they in, state or federal, that they don't have to listen to folks as much. But I think there's some folks out there who either would like to make those changes and want to make sure that they're not risking their political career, or once they see that their support for this, might be more willing to take this on as an issue that folks talk about. Because even getting it into a sphere of, let's talk about prison conditions and prison reforms and how we're treating these folks on reentry, I think at this point is a good step. Even if we're not seeing the progress we want to see, if folks are talking about it and it's actually an issue that's being brought up in campaigns and in speeches, and suddenly folks think they can get some political capital off of supporting these reform movements, I think that could be good. That was kind of a very sort of cynical Machiavellian take on it, but that is a little bit of what we learned is, you're more powerful in a community group as a voice, if in terms of, sheer numbers, if you get politicians who are thinking about voters and supporting this. And it's not just sort of from a moral standpoint. And the other thing that does is folks who have no idea about it. I mean, a lot of folks are here polled that they're not really familiar with the prison procedure or anything. It makes it an issue for them. We go to college campuses all the time, kids who don't even know about solitary confinement, but you can see that it kind of gets them riled up. And I think a lot of people, if this issue is more out in the open, would be on the side of reform, would be willing to make it an issue because Elizabeth's 100% right. Governor can't control the sentencing laws. Governor can't control if they want to continue to criminalize, things that shouldn't be. But the governor, and through the governor, the secretary of DAC do control pretty much every aspect of what it is like to be in prison, who goes to solitary confinement, what programs are available. how we're gonna, treat folks who we feel like are doing disciplinary infractions. What are we gonna make available in terms of reentry? They control a lot of that. So that, if they feel that pressure or feel like there is support for these reforms, those things, and a lot of things about what it is actually like to be in prison or what resources people are getting on release can change fairly quickly because they are things that the governor can do to some degrees independent of the legislature.
To add to your point, another thing that we can do is continue to introduce bills and addendums because we don't necessarily have to reinvent the wheel, but we can always add an addendum. More reasons, more opportunities of people to be released. If someone is within 5 years or along with an extended sentence, if they're sickly, they can be released with monitoring. They can use ankle monitors. That way they can be a productive member of society. They can contribute and put back. They can use their voice to help others. They can also put economy back into the understaffing issue. If there's not, it's supposed to be a 2-to-1 ratio that's never been in my life. I've been to 5 different prisons. I promise you, it's never been a 2-to-1 ratio of getting staff for me. So with that, to cut down on the understaffing, you have to relieve some of the problem. The problem is the overcrowding. You introduce different opportunities and reasons why you can release people, put the money back into the state. That should cut down somewhat on the understaffing because you need fewer staff to watch fewer people. So perhaps that might be an option.
Wanted to, before we close out, just ask you, Coop, if there's anything folks can do to kind of support the work y'all are doing in Western North Carolina now, any other asks for the group or ways that we can kind of stay connected and stay informed?
I would I would just say for the most part, the financial support because there is no eviction moratorium right now, so people can still be evicted. Our fair chance employers have been impacted. People have been laid off. So the best way I'm saying right now is the financial support for the rental assistance, home repairs. For the returning citizens, it's mostly going to be rental assistance, though, especially for those living in those halfway houses. And here in Asheville, North Carolina, we have tons of halfway houses, recovery programs, nonprofits, all the things. But we also have a high cost of living, and so halfway houses can range anywhere from $700 to $1,000 a month. I repeat, staying in a bed in a halfway house can range from $700 to $1,000 a month. So please keep that in mind as you consider raising awareness and fundraising on behalf of returning citizens in Western North Carolina.
And can you share again your either contact info, like your email or ways
Yes,
folks
sir.
can connect with Operation Gateway?
Yeah. So our website is operationgateway.org, and you can go there. Our website is up to date. We also have a donate tab, which is operationgateway.org/donate. And so we appreciate your support and your prayers. Keep praying for those who believe in the power of prayer. Do keep praying because only a move of God can help us recover from what just happened here in the Appalachia.
Thank you so much. I, Tim, I don't know if we want to wrap up a poll or and then I can close out. Go ahead.
I just wanted to read off the responses we got to our question. It was open-ended, so I appreciate your participation. The question was, what is one action you think advocacy groups should focus on next? And so we got a variety of answers. So some I'll read off some results. One person answered they should look for a quick way to come together and connect loved ones on the inside to those on the outside. So they gave an example that at one point, it was 8 days after Helene touched down that they were able to hear from their loved one. Another answer, ensuring that a background is not a barrier to food assistance. That's from our director of the Fair Chance Project, Laura Webb. A great day from you. One person said they're not sure, but perhaps those in an affected area should be transferred to a more safe location. And finally, we had one person say, who said, "I think it would be impactful for action groups to share these stories through a storytelling campaign. They think the public is unaware of what it actually looks and feels like for people in their community." So I appreciate you all answering those questions for us. We do have one final poll that's currently running right now. It's just asking if there was something today that you learned or that you were surprised to learn about during this conversation. So if you all like to take that time to answer that question, what's something you learned today? What's something you were surprised to learn today from hearing from our panelists? But that is the last poll I'll be throwing your way. So I appreciate you all participating and moving along with us. So I'll throw it back to our lovely panelists. Thank you.
Thank you. And just, I think we heard kind of another round from everyone. Just want to check in, Elizabeth, to see if there's anything else you wanted to share about ways things people can do.
I think everything everyone said was great. I especially want to reiterate what Luke said about organizing. I think getting people together to talk about these issues really is impactful, because when people care, things change.
Thank you so much. And thank you all for taking the time to join us today. As a reminder, the important discussion that we have now doesn't end here. So the Vigil for Freedom and Racial Justice continues every day from 11 a.m. to 4 p.m. until January 1st. We encourage you to visit that website, decarceratenownc.org, to learn more about the vigil and find ways to take more support, to urge Governor Cooper to take meaningful action during his last days of office. For anyone who doesn't know, he's already granted 2 rounds of clemency, and we are anticipating and pushing for more. But as you also heard on the call today, there are a lot of ways that folks can have opportunities for release, and when it's really critical, especially when there are major environmental justice concerns that they may be facing. So thank you all for taking the time to join. I'll just pause in case Tim happened to get any responses in that time before we close out.
We have some folks who said they got a good amount of resources they were not aware of. So I appreciate our panelists being able to share those, getting some folks connected with things they need. We have another answer that they learned about the complexities of the criminal justice system when compounded by natural disasters. They said they're enlightened and they can add this to the housing initiative that they are promoting through their church. So I appreciate our panelists for being able to share these resources and really tackling what the complexities are in a very real world, very tactile experience that so many people in our state are experiencing. So those are our answers. So we hope that people learned something today and are able to maybe bit motivated to help us do something about it. So I'll throw it back to you all. Thank you so much.
Great. So our next conversation will be on January 8th in the new year, and we'll be talking more about next steps for decarceration in North Carolina. So hope that you all will join. You'll also hear from us kind of a follow-up to this conversation and other ways to stay engaged. Again, thank you so much for being present and supporting freedom and racial justice and decarceration in North Carolina. We look forward to seeing you again soon. Have a good day.